Okay, so one of the last things on your teaching plan that we're going to look at is evaluation methods. How do you evaluate the effectiveness of the teaching plan that you put in place? So evaluation methods need to match the type and complexity of learners that are learning that is to be achieved. For example, if a learner is expected to list, state, or be able to identify something, the evaluation method must test for that information. So that should make sense. This is to reflect what you're saying you're going to achieve in your objective. You're going to now find a way to evaluate whether your objective was met and whether your teaching was effective. So evaluation methods must measure the desired learning outcomes to determine if and to what extent the learner achieved the expectation for learning. Always be aware that the options selected for teaching must be as effective, efficient, and appropriately used as possible. So you don't want it to be something more complicated than it needs to be. If you're asking a patient to be able to identify 3 steps, you shouldn't give them an example of tell me 12 things. That doesn't make sense. You don't want to ask for more than you taught. You don't want it to be more complicated than it needs to be. And how you measure and evaluate has to be must be based on learning domains. So for example, are you getting sick of hearing about learning domains yet? So for example, if you're saying you want to measure something in the cognitive domain, you wouldn't say, show me the steps. That is not cognitive. What you might say is, describe for me how this affects something. You know, that's cognitive. So cognitive, you're assessing something based on just knowledge. Effective, you're basing your evaluation on feelings, values, or perception. Psychomotor is evaluation based on skill acquisition. So I think that should be pretty well, you should be on top of that by now. Okay, 5 questions to ask to ensure you're using an effective instructional method. Does the method help the learner achieve the objective? Is the learner activity accessible for the target audience? Is the method efficient in relation to the number of learners? So would you, if you had 10 patients, would you want to do a demonstration and return demonstration? Probably not. Not very effective. Does the method allow for active participation and accommodation of style of the learner? That's a tough question. But you're going to be doing this mostly for individual patients. So you should be able to say, yes, I can accommodate the style of the learner because I'm doing one-on-one. And is the method most cost-effective as possible? Those are things that you want to always look at to say, is my instructional method going to help me in the long run? Your instructional method is also going to inform how you evaluate. So if your instructional method is demonstration with return demonstration, your evaluation process is going, or evaluation method is going to be return demonstration, right? So does that make sense? I'm hoping that that's it's sort of clear. This might be one of those chapters in your book that you might want to look at on how you do evaluation. All right, so this is review. I'm just bringing this up because I want us to keep on target. 8 components of a teaching plan. Remember what they are. It's a very simple list. It's in your PowerPoint. It's on your test, and you can look at the PowerPoint. So anybody who gets the 8 components of a teaching plan wrong, I have very little sympathy because it's written right in my PowerPoint. And that's how you're going to answer that question. I just want you to list those 8 things that I have listed on that PowerPoint slide. Okay, evaluation. The reason we're going to talk a little bit about what evaluation is because we talk about evaluation methods, and people sometimes think, oh, that just means, did I do what I said I was going to do? That's not really an evaluation. So an evaluation is a systematic ongoing process by which we measure or value something that we want to judge. Evaluation is a process that can provide evidence as to others as to what we do as nurses that makes a value-added difference to our patients. So your evaluation of your patient and your teaching is not just for the patient, for you to learn what the patient knows, but it's also for the patient to say, hey, that nurse taught me something, and I could answer those questions she asked me. So she must be a really good teacher, and she really told me something I don't know. One of the things we've talked a lot about, you've talked about in your papers, was how do I build a confidence level? And I think a big part of confidence in teaching is knowing that you know something better than the person you're teaching. Are you always going to be right? Are you going to be stumped by things sometimes, by a question somebody might ask you? Absolutely. I've been teaching for 30 years and I'm still stumped sometimes. So it happens. But to build your confidence level, I think you should be looking at your evaluation of your teaching as a confidence booster. When you ask a patient, now can you name 3 steps for doing something, and they can name them back to you, that is your reinforcement as well as your evaluation of your patient. But it's a reinforcement to you that you are actually teaching and that your teaching is value added for the patient. All right, so there's formative evaluation and summative evaluation. I don't think we need to know a whole lot about this, but I'll just say it quickly. A formative evaluation is where you're looking at something and you can allow for adjustment in your educational activity in an ongoing manner. Formative evaluation is what I have just done in light of the fact that this semester has changed format. I've gone through and said I need to adjust all the educational activities that we have for the remainder of the semester because I just did a formative evaluation of where we were at. Summative evaluation determines the effects or outcomes of the total teaching effort. So a summative evaluation for me is going to be that we do evaluations at the end of the semester. So then I'll look at how did I do as a teacher? Were there things that could have been done better or worse or what? All right, and then assessment versus evaluation. Assessment is a process-oriented activity. So you're not assessing your teaching. Assessing is what you're going to be doing when you look at your teaching methods and saying, is this really how I want to do it? So assessment is a process-oriented process. And evaluation is a product or an outcome-oriented activity. So you want to know the evaluation is to look at the end result. Okay, so steps for conducting an evaluation. You need to know what the focus of the evaluation is. What am I really evaluating? Am I evaluating the patient's outcomes? Am I evaluating my objectives? Am I evaluating my teaching method? What am I evaluating? Then you're going to design, construct, conduct, and do other things to solely develop some results. You want to find results. You want to figure out how did things happen. So the ways that you're going to look at an evaluation, you can do a process evaluation, content, outcome, impact, or total program. So I want you to think about that. For you, for the most part, you're going to be doing 2 kinds of an evaluation. Sometimes it's going to be a process content evaluation. Did I teach well? Did I teach enough? Did the patient get it? But you're also going to look at outcome and impact. Did it meet the evaluation that I needed it to, and what was the overall impact of the teaching? All right, and so barriers, sometimes when you're conducting an evaluation, some of the barriers are that you have poorly defined or focused clarity in what you're trying to evaluate. Sometimes there's a lack of support or lack of authority to perform an evaluation, and fear of punishment or loss of self-esteem. Sometimes we don't want to know how we did. But in this case, I want you to think of evaluation as a part of the teaching plan, and you have to always know what your outcome is, even if it wasn't good. Sometimes I've taught and it didn't go well, and that's my evaluation. So I just want you to remember, evaluation is the last step in the teaching plan, and you do have to have something that you're going to look at as a form of evaluation for your teaching plan. Okay, ways to evaluate learning. I'm not going to read this to you, you can read, but it's to observe, return demonstrations, ask the patient to restate, ask the patient questions, give simple written tests or questionnaires, talk with the patient's family, and sometimes ask the patient to problem solve in a hypothetical situation. Those are all things that we've looked at on video, you've seen them, we've talked about them in class. So I don't think you'll have any trouble doing that, but I want you to look at these and pick some of these things off this list to use as your evaluation method in your teaching plan. You don't have to come up with originals. You can use stuff right off this page. I hope that's helpful.